we work with operations for so many things. We partner with HR, we partner with clinical, we partner with supply chain. We're partnering with the specialty areas, the service lines to figure out how to, when we have access, how are we marketing? How are we communicating with patients? How are we communicating with prospective employees? How are donors being communicated? It isn't to say that all of those departments aren't doing an amazing job on their own, but we get to help and partner with them so that there's a shared message and an aligned messaging across the organization.
Welcome to the Health Leader Forge. My name is Mark Bonica, and I'm an associate professor in the Department of Health Management and Policy at the University of New Hampshire. Today's guest is Jen Gilkie, Chief Marketing Officer for Dartmouth Health, one of the largest health systems in northern New England. Jen has had a fascinating and surprising career journey, from studying theater here at the University of New Hampshire to being the Chief of Staff for the 2014 Super Bowl Host Committee, to finding her way to healthcare and marketing. In this podcast, we discuss rebranding, messaging during COVID, and more. I hope you enjoy this podcast, and if you do, won't you give it a rating on Apple, Spotify, or wherever you may be listening? Or better yet, share it with a friend. Thanks for listening, and here is Jen Gilkie. Welcome to the podcast, Jen.
Thanks, Mark. I'm very excited to be here.
So you earned a bachelor's degree in theater here at UNH. What drew you to UNH, and why theater in particular?
Oh my gosh. Well, the theater question is an easy one to answer because I had been doing theater throughout high school and I had these dreams about being an actress. Although that said, I didn't start my college career at UNH. I first started at NYU. And I went to the city from a very small town down on Cape Cod, and I was a bit overwhelmed living in NYU, and I took some time off, and I thought about where I might be happier. And my grandfather had gone to the University of New Hampshire, and I adored my grandfather. And so I ended up at UNH, and I was so happy there. I never went home. When I was at NYU, all I wanted to do was go home. I was really homesick and a little overwhelmed by the city. It was the early 80s, and it was a very different New York than it is today. Yeah. But I ended up at UNH probably because my grandfather loved it. And the theater department there was exactly what I wanted. It was a really well-rounded theater program. You didn't have to just specialize only in acting or only in design. You could really get a broad-based theater degree. So, and that's what I wanted to do, because even though I thought I would be a big famous Broadway actress, as any teenage actress thinks that they will be, I also had this voice in the back of my head that thought that I wanted to learn about other parts of the business of theater. And so UNH was a really good fit for me. The students, the community, the professors who were there were really fantastic and had lots of life experience out beyond UNH, as well as at the kind of more local New Hampshire community.
So you said Broadway. You were interested in Broadway, not movies, or what was the vision?
Yeah, I think there was probably a point in my life that went into my early 20s that I would have done any of it. And I remember taking a class in how to film commercials in Boston, and but I was always really, I loved the theater. I really loved plays and acting, and so that was what I imagined I might do.
All right, I gotta ask, favorite play.
Oh my gosh. Do you want to know one that I was in or one that I enjoyed watching?
Let's both.
Okay. Well, my most favorite play that I was in was Mother Courage, which is a play by Bertolt Brecht. And I will tell you that it's my I did it while I was at UNH. I performed in it while I was in UNH, and Tony Kushner came to direct it. And I don't know if you're familiar with the theater, but Tony Kushner went on to have an amazing career. He directed Angels in America. He's directed movies, and so he was at UNH. And that was probably my favorite acting experience. Um, you know, just because my memory fades, the one of the plays that I've seen recently that I liked a great deal was called the Lehman Trilogy.
Hmm.
And it was all about the Lehman Brothers. It was a really long play. It was about 3 hours, and it was performed by I believe it was three actors, and it was spellbinding. It was so fantastic. I'm more of a straight theater person than a musical theater person,
Okay.
although
Okay.
a good musical can get me jazzed up.
That's neat.
Yeah.
So you said you went to NYU and it was a little overwhelming, but when you graduated, you went back to New York.
I did, because as much as I was overwhelmed by it, I think it was I'd grown up a little bit. I went to California for a year. I came back, and then I moved to New York. So I had matured. I had gotten more comfortable in who I was and felt more confident about my life. My friend, I had a couple friends who were from UNH that were down in the city, and they said, "Hey, we have a spare room. We need a third roommate. Do you want to move to New York?" And I had come back from California, was saving money, and I said, "Sure, I'll go to New York." And and so I moved to New York, and
What was
I
the
was
vision at that point? What were you shooting at?
oh, I think not even think. I still thought I would be an actress of sorts, but it didn't take me too long um, waiting tables to realize that might not be the long-term job for me. And I was fortunate while I was waiting tables, one of my friends got me a job as a wardrobe assistant at the Second Stage Theater. And so I was making maybe like, I think it was like $60 a week doing that. It was like no money at all. Probably contributed to realizing I am not going to do this for my whole life. And I did start thinking about going to grad school at that point. But then I got an internship in the offices at the theater company, and I sort of opened my eyes to all the other things that I could do
Hmm.
in the theater and in the arts.
Okay. So you did do a kind of early career was a series of arts organizations. You were at Carnegie Hall, Lincoln Center, Royal Academy of Art, all amazing organizations. Were you kind of was what was that like as you were kind of thinking about your career and beginning to kind of maybe transition?
Yeah, yeah, well, first of all, it was so exciting living there and working for these different organizations. I have to say, I feel so blessed in my career to have had the experiences with the organizations and the people that I've met. I've just been really, really lucky. And working at those different arts organizations, that started opening my eyes to that there was a business side to the arts, as well as not-for-profits in general. And I kind of the transition for me was working in the arts administration kind of as an intern, and then I started working in development and fundraising. I started working on events at the not-for-profit, and lo and behold, producing an event was a lot like producing theater. And I had a small 501(c)(3) that I had started with a couple friends, a small theater company, and I loved doing that. But working for a larger organization was a little easier than fundraising for your own tiny little theater company. And so doing events was a lot like producing theater. And so that was my first kind of attraction to what it was that made me want to work at the different arts organizations. And they sort of got increasingly larger. At Carnegie Hall, it was the heyday of galas, when there were sort of all the ladies who did all the seating. They took like a week to do the seating for their opening night gala. I mean, honestly, I was a naive gal. I had no idea like what went on with true fundraising for these major organizations, and how tied they were to like the power brokers in New York, all their, at the time, it was mainly their wives who were involved in these. I'm happy to say things have shifted a little bit, but it was mainly their wives who were tied to all of these events and being the chairs of major, galas and opening. It was all just the energy, the adrenaline. It was really
That
exciting
sounds
times.
what a neat
Yeah.
what a neat way to have seen the world as it was at that time, and how it's evolved. What do you feel like you learned in those early years that's kind of that helped you start growing as a leader?
Um, well, a few things. I would say one was just to work really hard and to stay positive. To, you know, to ask questions when I didn't know the answer and it didn't take too long. One of my early bosses, in fact, a man at the Shakespeare Festival one time said to me, don't be afraid to ask questions and don't be afraid to say, I don't know the answer, but let me find out for you. That's okay. I'm never going to be angry if you say, I don't know the answer, but let me find out for you. And that's been something that has translated into what I do now. Even, in the role I'm in now, I'll say to people, I don't know, let me find out. And it's okay. Like people accept that. You don't have to have all the answers. But it's great to try to find the answers and also just to be kind. That's another thing and to listen to the people who work for you because and around you, they know what's going on very often. They know more than you do. And, another lesson that I witnessed a lot was one of my early bosses said to me, never be afraid to have people under you who are better at what they do than you are, because that's how you're a good leader. If you have the experts around you in areas, it makes you a stronger leader. So
That's good advice, especially in healthcare. um,
yes.
uh, so you kind of have a significant pivot fairly early on. You after a number of years, you leave the arts and join American Express, where you spend 12 years ultimately working in the office of the president. That's a big departure from the art world, at least kind of on the outside. I don't know, maybe it's really similar on the inside. What made you decide to jump from the Royal Academy of Art to American Express?
It was the Olympics. I'd been doing a lot of events at the Royal Academy of Arts. I did a lot of fundraising art tours. Like we would go to different places and I would plan these tours for art exhibitions that were opening in different places. And I had started to do a little bit of traveling for that job, which was fun. And it was honestly as simple as somebody I had worked with called me up and said, they're looking for somebody to come work on the Sydney Olympics and they're looking for an events person. It's a freelance job, but it's full time. So, and this was back in 1999. And they said, so, you'll have to pay your taxes probably on your own. You won't get it taken out of your check. And they said, but you get to work on the Olympics. And I mean, I was young. I wasn't married yet. I was like, who even pauses for a second to say, okay, to go work on the Olympics? And so I took that position and I went to work for American Express. It was the biggest event I could imagine
Yeah, that's it.
working on. And they weren't a sponsor like Visa. They were like they had a hospitality event, but it was bringing in 4 different waves. We brought in these CEOs from around the world, from like global companies and their spouses, 25 in 4 waves. So I went to Australia like 5 times in a year and spent 2 months there. And, we went to the opening ceremonies, we went to all the different events. It was phenomenal.
So you were learning this, so you were continuing kind of with the event planning. So that's the through line, is this kind of
Yes, the event
event
planning was
planning.
the through line.
All right, all right. So then you transitioned to full time with Amex. You stayed with them. They
Yep,
hired
I
you in.
did. After that, they hired me full time, and the next big project I took on was the Salt Lake City Olympics in 2002. And And before that, between those two Olympics, of course, was 9/11, and everything changed, because and American Express was headquartered down at Ground Zero. Our headquarter building was right across the street from the World Trade Center. So we were like, that was a very crazy time in my life.
Yeah.
And but we weren't even sure at one point if we would end up doing the event at Salt Lake City, but we did. The security between the two events was just nuts because nobody knew what to do, and we spent a lot of time planning around how the security would impact the event at the Salt Lake City Olympics. But we did the Salt Lake City Olympics in a similar style to Sydney. And then I went on to do a bunch of different global leadership events and client incentive events for the CEO. We did ski events. It was, and I got to travel. And again, I was young, I wasn't married yet, and I had I didn't mind traveling all the time.
All right. So now I'm seeing the through line now of events and sports because you leave Amex in 2011 to become part of the 2014 New York, New Jersey Super Bowl host committee. So what was that?
Yeah. So that was following this person named Al Kelly, who became one of my mentors, and just he had a tremendous impact on my career. And he was the president of American Express, and he left. And about 6 months later, he took on this job to lead the host committee, and called me and asked me if I might be interested in coming as his chief of staff. And I'd been working for him, so it was not a hard decision for me, because again, it was that, and that was another one of those through lines. Like I started to realize somewhere along the line that I was attracted to big events. I was attracted to brands. And I've come to realize in my career that I'm really interested in like what the company is or what the brand is. I like that sort of exciting energy that comes from working for a large organization or a company that has a big presence, big personality, maybe is the right word to say. And so, yeah, so I went there. It was the first cold weather ever. It was the first cold weather Super Bowl ever. It had all of these firsts. It was two teams, the Giants and the Jets hosting. It was the city of New York. It was two states, New York State and New Jersey, were all kind of, and the city, of New York has its own, government structure, municipal structure. So it was all of these really puzzling pieces having to come together and collaborate. And anybody that knows New York and New Jersey politics knows that they are often at loggerheads. So it was really, really fun and challenging and frustrating. And I just wanted to make one more point, is that the Super Bowl host committee, in much the way the Olympics establishes a host committee, it's separate. It's a 501c3 that's separate from the NFL. So just like the Olympics has a host committee, cities that do the Super Bowl do the same thing. So it was separate from the
So
NFL.
so what I was going to ask you, like, what does the host committee do as opposed to the NFL? Like, you're not putting on the game itself. What did the committee do?
Yeah, so they are responsible for kind of building the bridge in a location between what the NFL wants to do and what the city or what the state feels like they can provide. So figuring out the transportation is a big part of it, getting the volunteers. The Super Bowl has a tremendous number of volunteers. And gosh, I should have looked this up before we talked, but I'm pretty sure we had 10,000 volunteers for the Super Bowl. It was a ton of volunteers. So managing all the volunteers, you also find like the host experience. So for all the owners, you have to create this owners event with the two team owners. All the owners come into town. So there's a lot of like that entertainment element to it. And then there's fundraising. Like we called it the Snowflake Foundation. And we wanted to leave a lasting impact on the community for hosting the Super Bowl. So we raised money for the Snowflake Foundation so that in fact, we refurbished a lot of facilities. There was a Boys and Girls Club out in Newark, New Jersey. We redid their swimming pool, and we did their gym. We made grants to a lot of community-based organizations, so that, that there would be a lasting impact from the Super Bowl having been there.
Wow. Um, so what skills do you feel like you had learned at this point as a result of this kind of work? And now you've done 2 Olympics, now the Super Bowl. Were you a sports kid as well as a drama kid? Like,
No,
okay, yeah, you kind of, so this just kind of became
no.
a thing that you were working at the top of sport, but yeah, okay.
Yeah. So no, I was not a sports kid at all. In fact, one of my favorite stories to share is that I had never been to a football game in my life. My high school did not have a football team, and I had never been to a football game before I worked for the Super Bowl host committee. And the first football game I ever went to was the Super Bowl in Indianapolis when the Patriots played the Giants. And my family members were like, it blew their minds that I, of all people, was working on the Super Bowl. And my husband in particular came home one night early on, and I was like watching Sunday Night Football, and he came home and he was like, "What are you doing?" And I was like, "I'm trying to learn about football because I go into the office on Monday and everybody's talking about the games and I have no idea what they're talking about."
So you must have found you were particularly good at this kind of thing, though. I mean, like you kept coming back to it, you were asked to do it. What were the skills that really made you good at that?
I think the logistical pieces and the details, and I think my theater, like the creative part of my experience earlier, has always played a part in the work I do, because it makes me I'm like, and I'm kind of like, I love to think of ideas and creative ways to do things. I think out of the box a lot. And so I think that's a skill that I've brought to everything I do. And just like, I love to learn. I'm really curious about people and how things work. And I love people. I love to talk to people and hear their stories. And, yeah, so I think those are things that I've brought to what I do. And I love to build teams, and I love to lead teams, and just, it's remarkable what you can do as a team of people. I don't think I understood that as much earlier in my career, as I came to realize that it just takes a team. It's never one person.
Yeah. So you were doing a lot of, I mean, this is a lot of operational work. I'm picturing,
Yes.
logistics and planning. What about, and you said you like to work with organizations that have big personalities. So the NFL, definitely big personality. But where did you kind of fit in where did you start leaning into the public relations and the marketing and the branding?
Well, I actually,
Was
a
that,
little bit when I was still at American Express, because I worked very closely with the sponsorship and the marketing departments. I did a lot of work on communications for the events. We would often be marketing the events, even though we were inviting people to come to them as our guests or inviting employees to participate. We still did a lot of work, kind of advertising them, quote unquote, and communicating information. So I started to learn build some of my communication skills there. And when I was at the Super Bowl, one of the things that sort of fed up to me to oversee was the marketing work and the advertising. So that reported into me, and the events and hospitality. And so that, and I was really lucky because I was one of the first 5 or 6 employees. So we engaged an agency, we built the brand, we built the logo, we were building like the value proposition, what was the brand of the host committee. So I could say I learned a lot about the marketing elements of a big project while I was there. And that would that was, and then I did all the communications while we were there for my boss. I helped, do a lot of the work with the board. So again, just a lot of writing, a lot of learning and presentations, a lot of HR work too. So
Yeah. So this organization, of course, had a natural expiration. You have the event and then you kind of wind things down.
yep.
And you moved on at that point to New York Presbyterian Hospital to be the vice president of external affairs. So this was the first, was this your first exposure to healthcare?
It was. And again, one of those times where my family was like, you're going to work in healthcare, with like a frowny forehead at me. And New York Presbyterian has this, and they still have it, although they have a little bit different take on it, but they have this amazing ad campaign that is called Amazing Things Happen Here, and amazing things are happening here. And it's TV commercials and they genuinely touch on your emotions like nothing I've ever experienced. So I was just attracted to that, again, that brand and like what they did. They're remarkable. And their executive vice president, this woman, Laura Faris, amazing. Again, somebody that just had such an impact on my career. She had said to me at the end of the Super Bowl, "Oh, why don't you come and have lunch with me? I'd love to be helpful to you." Everybody knew it was going to wind down. I'd worked with her a lot throughout the Super Bowl. And I went and had lunch with her and we started talking, and she was like, I'm building a team of vice presidents for our regional hospital system it was relatively new and just coming together as a system. And she started talking to me about the role that, there was going to be a role for external affairs with community relations and marketing and communications. And I left that lunch. It was like an hour and a half. And I left that lunch and I was like, oh my gosh, I think that she might be thinking that I could do this job. And I actually, because I was so overwhelmed with not thinking it's healthcare, it's another language. And I said to her, I don't know, Laura, I don't really know anything about healthcare. You have a lot, these people are so smart. And she said, that's fine. It'll be good. It's good to have people who come from other backgrounds. And you're going to ask me anything you need to. And it was like, Mark, it was totally those first few weeks, all I was doing, I would be like jotting down acronyms all the time, because anybody knows healthcare, you just like, there's all of these terms. And there was even this point where they kept talking about CMOs, and I kept thinking, why would they need a chief marketing officer at that meeting? Or why would it, and it literally was not like until a week later that I figured out that the CMO was the chief medical officer. Not the chief marketing.
That's was my experience when I first went in the Army with no healthcare training, and I got dropped into a clinic management role. And I always say, like, I know these people are speaking English, but I have no idea what they're talking about. It takes a while, but
it does.
This is a pivotal experience for you again. You had worked in the arts, finance, pro sports, now healthcare. So what was it that helped you make that transition this time?
Again, it goes back to people, like people who were really willing to take me under their wings and answer questions and teach me. I think, like, I like to think I showed a willingness to work really hard and a real eagerness to want to learn. And I've also learned sometimes, despite how much I'm talking today, that it's good to be quiet too, and sometimes just sit and listen. Going back to like what one of my early bosses told me was just listen, take it in. And so I did do that. That the other thing I would say is that I was overwhelmed with how smart and like unbelievably dedicated the people were in healthcare as soon as I got there. And the idea that I could make a some sort of support them in some way in the work that, and I still feel that like whenever I have a down moment, I go and I like walk around the medical center, and I can get inspired again just by seeing all of my colleagues who are taking care of people, like making them healthy again or helping their families through really difficult times. That was the most inspiring work I've done, that in many ways. So yeah, I would say it was the people, like,
Yeah.
again, just being around those people and all those really smart people.
What was most challenging, would you say, about moving into this new industry?
Um, it's probably one of the times in my life where I battled the most with imposter syndrome. Like, how could I possibly bring value because medicine was new to me. And medicine in many ways is like a family business. There's so many people in the healthcare world who have grown up with parents who were in the healthcare sector. And I was not. My dad was an accountant and my mom was mainly a stay-at-home mom and artist. And so I did not have that kind of background. So I really battled feeling a little bit like that imposter syndrome. And that's like a common thing, I think, especially for women to have to battle sometimes, is that imposter syndrome. And it was hard. It was just that was a hard transition because
Yeah.
it was exhausting taking in understanding how a health system of that size and scale worked and not knowing anything about healthcare. But I credit Laura with having the belief in me that I could do the job, and she stuck with me and I kept at it.
Yeah. At what point did you decide? I mean, I don't, maybe I don't know. Maybe you've got another pivot and you're going to go like into the aerospace industry yet or something, but did you decide like, hey, healthcare is pretty cool, or I think I want to stick with this? When did you feel like you were comfortable with the industry?
Yeah, you know, I think I knew pretty quickly that I was interested in it. Um, I would say I knew by the time we were making a decision to move to New Hampshire, I knew I wanted to stay in healthcare. I really did not think that I wanted to leave. I actually felt a regret that I hadn't found healthcare earlier in my career, and I still sometimes feel that way. And I wonder, oh, what it would have been like to have found it earlier. Although, it is what it is, and I try not to live with any regrets. I just,
I don't know. You did some pretty cool stuff.
yeah, yeah.
Couple of Olympics. Yeah, that's pretty cool. Uh, so 25 years of living in New York City, you decide to uproot and move to little old New Hampshire or back.
Yeah.
What brought you to New Hampshire?
My really it was more personal. Like, we were starting to my husband had grown up in Manchester, New Hampshire, and his parents were here or are here. My dad was getting older and is still with us. He's great. He's just turned 89. But he was getting older and could use some help. And I'm an only child, and my daughter had hit that age. She was in 5th grade. We were thinking, okay, if we're gonna move, we need to do it. We'll need to do it soon. And the city was just starting to take its toll. Like, I love New York. I still miss it, but we were just ready for a different environment. And we found this fantastic, we actually found the place before we figured out what we were doing. We found our home. It's a farm, a non-working farm. And we fell in love with this property, and it sort of opened this whole new idea that we could live in the country. And so
Wow, New
I
Hampshire's
guess
got a
that's
lot of
my
that.
theme.
Yeah.
Like, I just like to do different things.
Yeah. So you briefly work for a consulting firm but pretty quickly joined the team at Dartmouth Health. So before we kind of dig into your current role, or your evolving role, uh, can you tell us a little bit about Dartmouth Health? What is Dartmouth Health? What makes it special?
Yes. Dartmouth Health is an academic health system in serving about 1.6 million people in New Hampshire and Vermont. We're just under $3 billion a year in revenue. We have a number of critical access hospitals and community hospitals, which are larger than critical access hospitals. We have a large component of clinics. We call them the Dartmouth Hitchcock clinics in southern New Hampshire, as well as Vermont and Keene, and up near our academic medical center, which is up in Lebanon, New Hampshire. We are a separate organization from Dartmouth, but we are very closely linked through the Geisel School of Medicine, where our residents train. We're one of the largest rural health systems in the country, so we're very proud of the rural healthcare that we provide, which is very different from urban.
Is it the only rural academic medical center? It's got to be one of a few, right? It's maybe.
Yeah, it's not as Mayo, believe it or not, is considered a rural health system. They don't talk about that a lot, but they are actually a rural health system. There are others as well. You know, you think about Marshville Clinic, Iowa. There are others, but we're one of the largest. And you know, we're a unique organization because we have our NCI designated cancer center, which is one of only 56 in the country. So I always like to talk about that a lot because people don't realize that just right here in New Hampshire, we have an NCI designated. We're one of the best cancer centers in the country. So I do like to talk about that. We have the only children's hospital in New Hampshire, Children's Hospital at Dartmouth Hitchcock Medical Center, CHAD. So we are state of the art. We have the same kind of care that you could get in an urban area, but we have it right here in New Hampshire and Vermont.
And you don't have to fight the traffic to go into, I don't know, Boston, maybe.
Correct. Correct.
Or New York City. Yeah, it's a lot easier to get up to Lebanon than it is to get into Boston. So you started in 2017 as vice president and head of communications and marketing, but you have since kind of been promoted twice, first to system vice president for communications and marketing, and most recently to chief communications and marketing officer. So tell us a little bit about how has the role evolved, and the titles have changed. How has the role evolved, and what you do for what you did and now do for the organization?
Yeah, so the largest change has been my job has kind of grown just as we have grown as a system. When I started, we were technically a system, but we were at that point functioning very independently. All the hospitals and the academic medical system, there was very much a kind of more of an us and a them approach, and now we have a very large we. We try to act together. We try to work together as one health system. COVID, huge part of that, because COVID on so many different levels brought us together as a system and showed us ways that we could, you know, we had to work together. We had to kind of bring our supply chain together and distribute where it was most needed at what time. We were working to, you know, take patients from different places. So I would say that when I first started, I was really much more focused on the central kind of what I think of as now today as the central marketing and communications team, and very focused on the medical center and the clinics. And now that work has just expanded to become system-wide. So that's been the evolution. We rebranded, which I know you want to talk about, but I'd love to talk about that. We rebranded as Dartmouth Health. Really is a way to bring us all together under kind of one parent, one system. That's been the kind of the greatest change. Sorry, no, that's been the biggest change during my time here has been the growth of the system.
and your role is more integral in kind of working across the system.
Yes. Yeah.
Okay, so you talked about using we more than, or us versus them kind of, but we across the system. So I imagine some of that would have been marketing, some of that would have been internal kind of marketing. But so you would have had a role with that. The operation side, I assume, was talking that way as well. How do you work? How did you work with the operational side of, as they're trying to establish that unified identity,
Yeah.
as a brand, but also like internally, or maybe that's all one. So tell me.
Yeah, well, I often say there's one brand, internal and external, it's all one brand, but we partner with operations and earlier on we were often, we'd get things and we were often thinking about how can this reflect all members, right? So, very often there was this tendency to think about Dartmouth Hitchcock Medical Center and then the other members. And so I think through the brand work and through the communications, we've been able to really drive home that we try to like really reinforce that we messaging that I just spoke about. We work with operations for so many things. We partner with HR, we partner with clinical, we partner with supply chain. We're partnering with the specialty areas, the service lines to figure out when we have access, how are we marketing? How are we communicating with patients? How are we communicating with prospective employees? How are donors being communicated? It isn't to say that all of those departments aren't doing an amazing job on their own, but we get to help and partner with them so that there's a shared message and an aligned messaging across the organization.
So kind of digging into your organization that you oversee, like
Yep.
open up the black box. What are the pieces inside the organization that you oversee?
Yep. So we have a department that oversees, so I oversee the internal communications, which includes employee publications. So we've created an employee magazine newsletter that is for the whole system that recognizes and celebrates employees and all of our members. We have our sponsorship and partnerships, so doing community partnerships with organizations throughout the region. We have all of our marketing, which includes like paid media, direct marketing. We have our digital marketing. We have media relations. We have all of the website. We have 23 websites that we oversee through the department. We have our intranet that we also oversee. We've got kind of an internal agency, a creative productions team, and they are awesome. They do all of our graphic design and photography and video work, all of the collateral and kind of production around signage and the digital signage throughout the organization. We've got kind of a thought leadership external affairs group that works on nominations for awards and, recognitions. They do help with preparing our leaders for speaking opportunities. Yeah, so that's who the department is. Right. I have such an amazing team of people that I get to work with every day, and I feel lucky every day when I come to work.
Well, that's a great feeling to have. When we talk to our young students about marketing, they kind of use it as a synonym for advertising. So what is, speaking to my students, what is marketing? What do they need to understand? Like, it's more than just advertising.
Yeah, it's funny because I definitely would have thought that too in my younger years. I think marketing, I will explain it as external messaging. Even though we do internal messaging, it's taking what a brand is, who we are, what we want to do. And of course, sometimes we're selling. I mean, marketing is, at the end of the day, marketing is sales, but authentic marketing is sharing that message honestly and differentiating who you are for people to understand it and hopefully be aware of it and prefer it and select it. That's ultimately, what you're doing, but it isn't just advertising. It is, I think there's so many different kinds of advertising, and we call it paid media now. So we have a lot of different types with digital, it's all changed even in the sort of 10 years that I've been working around healthcare. It has changed tremendously. Billboards are still used quite a bit here, but I was just at a meeting last week with my counterparts from across the country, and we were all talking, they were all talking about digital, and we were talking about AI and how AI is going to change things as well, which is a whole kettle of worms I haven't really dug into yet. But there are, there's just so much data that is informing how we can share messaging that people need or want, or how we can meet their needs a little bit more effectively and in ways that are targeted. Some of that's a little scary, right? Because there's so much data. I learned this fascinating point last week that Google is making something like $8,200 a year off of every person that uses Google from the data that they garner from your searching.
Oh, wow.
Yeah, isn't that interesting?
Yeah. So we've talked a bunch about branding and brands. So I wanted to ask you, what is a brand? So we'll get into the fundamentals.
Yeah. I would say it's your identity, right? A brand is
Okay.
who you are. Brands have pillars. They have the key differentiators. A brand is your logo, is not just your logo, it's your fundraising, it's your way that you talk to your patients, it's the way you talk to the community, it's all of the different elements that make you different, and you experience brand in so many ways, right? Like you could experience it through a sign, you could experience it through how your doctor takes care of you, and of course that's healthcare, but it's a brand is just so much more than just a logo. It's the message, it's just the essence of who you are and what you are as a company or an organization.
So you were talking about how when you first got there, the system was more of a loose confederation, if you that makes sense. But through COVID to now, the organization has been working to have more of a unified uh, experience, so a unified brand.
Mhm.
And I remember we had a conversation pre-COVID, and I think I had said, "Hey, we should do a podcast." And you're like, "Yeah, as soon as I get the brand thing done." And then COVID happened, and now here we are 5 years later.
Yeah.
Um, but how much was the rebrand part of the effort of the organization to have a more unified presence, be a more unified organization?
Yeah, it was huge. So in 2018, Dartmouth Hitchcock Health at the time the board had undertaken a strategic planning process. And out of that strategic plan came kind of a mandate to build a unified brand and come together as a system. And I credit Joanne Conroy, our CEO, with just she was such an amazing support and partner in getting us to the new Dartmouth Health brand. So I would say that was a huge part of why it was really the real reason we rebranded, was because the board wanted to find ways to build those bridges with the members, and another thing, we were fortunate enough to have Dartmouth be willing, being able to affiliate ourselves with such an elite, outstanding, world-renowned educational institution was huge for us. So getting rid of the Hitchcock, simplifying it. There was tons of brand confusion out there. Our market didn't understand who all of these different, I've got this great slide. If this was a visual, I could show you, like if it was a podcast that was visual, like there's like 50 different like logos and center identities and we were just pulling it down into like a much simpler, cleaner way to think of the brand.
Sure, because you had acquired organizations over time,
Yeah,
um, you know, and so you would have had all that kind of uh, leftover branding from when they were all independent. So that
correct.
was part of it, was getting rid of all that. Um, so what went into the process of rebranding? Like how did the new logo come about, and how did you decide to drop the Hitchcock portion and
Yep.
all that sort of
Well,
stuff?
let me just tell you that it was the longest rebrand because it was in the middle of COVID.
But COVID.
We had kicked it off about 4 months before COVID, and we started with a discovery process, which first we went through an RFP to find a branding agency. We went through a really thorough vetting of different agencies, and we found a great agency, Applied Design, to help us, and they came in and did a discovery process with employees, with our lead stakeholders, really trying to understand all the members, the CEOs, really trying to understand who we believed we were. They did a competitive market scale, look at the competitive market landscape to understand how were we positioned currently, like where did we want to be. They built this really great grid with where they placed our different competitors on the grid and where we were, and we had sort of like high community to low community involvement. We had the clinical care, and we really knew that we wanted to differentiate ourselves by being known for providing world-class care in the community. And so they took all of the research and gelled it down into a brand idea, which is world-class care woven into the fabric of our communities. And from there, they started building on logos. And I think we worked down to 3 different logos, identities, visual identities. And the one that we ultimately chose is meant to identify kind of that weave, we call it the weave, of the threads of our community, kind of interwoven and interdependent on one another. And then the idea too was that textile, that this area has a rich history in textiles in southern New Hampshire, the mills. It was meant to reflect a little bit of that, of our heritage. We intentionally have 2 different fonts with Dartmouth and Health. The Health is a little bit more contemporary. The font used in Health, and the font used in Dartmouth is supposed to reflect a little bit of our heritage and our history. We updated the palette. So we brought it to a little bit more of a contemporary color palette. We kept the traditional evergreen, but then we had juniper and spruce. We brought in newer colors so that we could make it just a little bit more approachable too, a little less serious. I think it has a little bit more of a friendly openness to the look and feel of our logo.
So you talked a little bit about the origin of the rebrand came from a strategic planning process.
Mm-hmm.
How do you decide what the key strategic priorities are for Dartmouth Health's marketing and public relations efforts at any given time?
Yeah.
What process do you use to kind of prioritize your effort?
Yeah, it's hard because you never want to say no. And in a health system, I'm sure you've heard this before, there are so many like needs all the time for like getting information out there. And there's so many innovative and discovery type of work that's going on all the time, and people just want to share their information. They have so much knowledge, and so it's a really hard thing to figure out what the priorities should be, because you're trying to balance mission with sustainability. And we all have such challenges on the sustainability part these days. So ultimately, I want our priorities to support those of the organization. So whatever the sort of the board and the leadership team are deciding are the priorities for the organization, ours need to support that. So once a year, we do we go through a process of coming together and framing up our priorities. We've actually shifted in my department. We used to do it once a year. Now we're trying to evolve more to an ongoing strategic planning process, because we didn't have a communications and marketing strategic plan when I got here. So that's something that we've built over the time I've been here. I've got amazing leadership colleagues in the communications and marketing department. We've started to bring in the member communications and marketing team as well to help build that plan and really think about how we don't just support the medical center, right? We're supporting the whole system. So thinking about how our priorities, a key one is driving our reputation, perception, and awareness. We want to continue to build on our standing nationally, locally, and regionally. We want to be able to compete and grow volume and help with the sustainability. But we also importantly think about, okay, we have one of our priorities now is having a positive and high quality patient care journey. So we want our patients and their family members, no matter where they touch the system, digitally, if it's on the website, if they're walking through our doors, we want to figure out how does communications and marketing support them having a positive experience.
So as you establish these strategic goals for in support of the larger systems goals,
Yeah.
how do you measure success? How do you know if what you're doing, the efforts of your team, is working?
Yeah, that is not always easy in communications and marketing to sort of we use quantitative and qualitative metrics. We have a couple different brand studies that we do. We have a brand tracker study that we can understand what the awareness is in the market. Are we moving the needle? How many people are exposed to our different campaigns? So we track reach and impressions. Our media mentions, we keep track of how many inquiries we're getting, how many impressions are we making with our different media outlets, what's our share of voice. We want to know how our visibility is compared to our competitors, website traffic, social media, new patient appointments. That's another way that we can tell around if we do a specific marketing campaign, we can usually tell if we're making inroads with volume. How many patients, another way you can tell, of course, is how many patients come back for follow-up care, reputation and trust. There are a number of ways that you can tell there with net promoter score. Customer reviews is another way that we can tell. Campaign performance, the ROI, the revenue that comes out of a particular marketing effort compared to the cost is one of the ways that we can tell how we're doing. Ultimately, we don't have as many digital tools as I wish we did, but
Sure.
I'm confident, look, we'll get there over time. But those are some of the ways that we can tell.
So, I mean, a big part of your organization's function is public relations. I know there's a strategic kind of long-term public relations, but also like I think a lot of people think of public relations, they think of crisis. And of course, COVID was kind of a big crisis. So what was your role? What was your department's role during COVID in supporting the organization?
That was such a, oh gosh, a hard time, but it also brought us together and it brought out the best in people. And we very quickly, we were doing daily updates. So we were writing communications. We were sitting in on the incident command. At the incident command, we were part of that, where we were getting information. We were some days it just felt like, even like before the vaccine, it just felt like the information we were, it was only coming so fast and things could change, were changing on a dime. And I think back to all those really, really long days and nights where Joanne, again, in an amazing kind of CEO mode, she said to me at one point, she said, I trust you. She said, if you can't get to me, just get the information out. And she was like, I have confidence in you and your team. And it's more important that we get the information out. If I'm getting, because she was getting pulled in a zillion different directions. She also made sure that we were getting the information we needed to share with the larger organization. She advocated to make sure that we were all at the table hearing the information that we needed. We had this idea, we were able to take challenges. We had this idea when the 6 foot, when the whole thing started with you needed to stay 6 foot apart from people. We developed these dots that we literally went around the medical center, and then we were able to say to all the hospitals in our system, hey, we're doing this here. Do you want this too? And again, in a tribute to systemness, we started to like share our best practices. So we created these big, large dots that we would literally put in the hospital, anywhere where there might be a line that reminded people, like, we're 6 foot. People on my team were out there with their like tape measures, figuring out like what was 6 foot to put these dots down. And the signage, like with masking, we were constantly like, we were having to put signs up and reminding, like, use hand sanitizer. There was just so much of it, so much of a key part of what was going on. But at the same time, we were reliant upon one another, and we built that, for me, for communications and marketing for our department. That was just, we built such a strong team because we were like going through this war together. And when vaccines came around, it was just, for me personally, look, I know there's a lot of different opinions out there about vaccines. Most of the people I work with are big believers in them, I would say, for obvious reasons. Yeah. And I can remember being overcome with emotion when I got my first vaccine because, of everything that we had been through.
Yeah, I had the same reaction. I think, it was like cloud finally lifting after months and months and months. But with regard to like communication during COVID, you were saying, getting the information out. How much was your focus internal versus external? Like, what were your priorities for that?
Yeah. I would say it actually maybe it sort of blurred, right? Because we wanted the same information to be available internal and external, especially about how to stay safe, what we knew about COVID. And that was actually something that we started to do that we had not done in the past, which was we started recording our own video interviews, or just programming from our infectious disease, our head of quality, our chief clinical officer. He was amazing, Ed Marins. He just like would jump in front of the camera for us to like get the information out there. And then our media department, my media team, would just roll out the media release with a clip for people to get their information. We did some webinars. So it was both internal and external. We would promote it internally and externally, and had viewership on and readership on information internally and externally. So I have to say it blurred a lot between.
Yeah. Because a lot of the same information was necessary on both. Yep. Right. But you must have had, you would have had internally, you would have had employees who were afraid to come to work, or or things like that. Patients who weren't sure. I guess it's kind of related, to can I safely come to the hospital? Who should come?
I mean, it was such a crazy thing, right? We were all just learning things. The information was flying around, and those first few days of incident command, we were all like hunkered down together, like in a room together, trying to like figure it all out. And just as like information from the CDC, all of a sudden it was like, oh my God, we can't all be in a room together because, but it was okay. Like nobody condemns anybody because every healthcare organization in the country was doing the same thing. And then we were all like, wait a minute, we need to all be separated. And so it was like this crazy, crazy time.
Yeah, the
Yeah,
EOC, the Emergency Operations Center, is usually everybody gets in the same room because you can make information flow faster. Oops, can't
correct.
do that.
Yeah,
Yeah.
exactly. And when you think back to like even in New Hampshire, like the tests at the beginning, there were only a certain number of tests that they could do a day. And
Mhm.
that was true throughout the country. Like getting a test was like considered really, you're hard to do. And then it had to go through a whole process with the state because they were all learning too as we went. So we're gonna all have these stories to tell our grandchildren that are unbelievable.
So kind of you mentioned vaccines, and yes, there is some debate. I think there is some legitimate debate about specific aspects of the campaign. But I think that characterizes a challenge of information flow. I hate misinformation, misunderstandings. I mean, like how, in healthcare, it's a scary thing. Like everybody was afraid.
Yep.
Um, so how do you handle the challenge in public relations of especially in something like healthcare, where erroneous information, if you will, can spread really quickly because people get scared and anxious.
Yeah, so I think, and this is where I think my non-healthcare experience has done a good job for me in that a lot of what I've tried to engender in the way we share information is like if I don't understand it, I feel like I'm like I represent the average mainstream person. I mean, now I've got a little bit more healthcare experience than I used to, but I really try hard to look at things the way my dad or my neighbors would who have no healthcare experience. It's about sharing the information is in plain language as basically as you can, because most people, healthcare is very complicated and very complex. So it's about breaking it down as simply as you can and finding the key message points and providing the resources for people who want to learn more, but really trying to keep it simple and straightforward. And that's what we tried to do with COVID as much as we could. We tried to stay fairly simple, and a lot of it was really complex.
Yeah, yeah, and yeah, as it is with healthcare. It's
Yeah.
um, so kind of wrapping up. You're the chief marketing officer, not chief medical officer, but chief marketing officer for largest healthcare system in New Hampshire, and I guess probably in northern New England.
Yeah.
Uh, uh, what keeps you up at night?
Right now, it's actually talking about that subject is just communicating what healthcare means for the community and for people. I don't think people understand how it all is tied to like politics and government and funding and how important it is to make really smart decisions about who's representing your cause, and to understand. What keeps me up at night is that people don't really understand the stress and the strain that the healthcare system is under right now, um, and how critical it is to figure some of these problems out for the long term, because eventually the sustainability, going back to what we were talking about at the beginning, and balancing mission and sustainability, like we have such an obligation, and I feel that at Dartmouth Health, to keep our community healthy. And there's so many challenges just keeping our society healthy, figuring out how do we help prevent people from having to get to us in the first place, right? We want to keep them healthy so they don't even need healthcare, but just that messaging piece, that understanding how to keep it simple and to involve people to help them become more active in their own healthcare making decision, like so they can understand it. So it's not like a foreign world, to help break down the fears. Those are the things that keep me up at night.
So as we've talked about in the past, I teach, mostly undergrads, who are interested in a career in healthcare. What would you is do you have a book that you would recommend, that if somebody was interested in pursuing a career in healthcare, specifically maybe health marketing in healthcare, but doesn't have to be marketing specific?
Okay.
Um, what would you recommend folks who are looking to go into the field read?
So there is a book that I have recommended this book so many times to people that I read back when I worked at American Express just because it was an interesting book to me. And little did I know that I would end up in healthcare, but it's called When the Spirit Catches You and You Fall Down.
Good book. Yeah.
It's a great book, and it is the thing that I like most about it is that it reminds you that there are all different, everybody brings a different understanding and a different history, and everybody is unique in the way they approach their healthcare and the world, and that you shouldn't discount one thing for being wrong. And I think healthcare has grown a lot in embracing all different kinds of culture and forms of care, but it really it was so intriguing to me and gave me such a viewpoint into the healthcare system in this country and culture and different ethnicities. And so
Yeah, the main theme, the broad theme is cross-cultural kind of values in healthcare. And
yeah.
for a young person thinking about a career in health, why should they be like, I should go into marketing and public affairs?
You know, because you're supporting kind of the work of keeping our society healthy. How you are helping, education is everything and understanding is everything to our society. And by communicating and taking messaging and taking knowledge and sharing it, you're helping keeping our society as a whole healthy, right? So yes, you're supporting your clinical colleagues to keep people physically healthy, but you're also there's at base, if you don't have health in this world, what do you have, right? If you're not healthy, like healthy is what you want. And I would say doing communications and marketing is supporting that health journey of our whole society.
So thinking about your career, and we were joking about this before we started recording, if, thinking about your career and kind of where you came from and where you are today, if you could go back and, talk to that 22-year-old Jen, she's down at Scorps, the night before she graduates, or Libby's, what would you tell her? What career advice would you give her?
Gosh, I would tell her not to, I would tell her just to keep making bold decisions, not to be afraid. I certainly think there were times in my life that I was probably more afraid than I needed to be, and that just to stick to it and to be bold and adventurous.
That's a great message to end on. Jen, thank you so much for your time today. It's been great.
Oh, thanks. This was a blast. Thank you.
You've been listening to the Health Leader Forge. Please go to our website, healthleaderforge.org, for more information or to leave comments about today's podcast. Look for Health Leader Forge podcasts on iTunes, Stitcher, SoundCloud, and other podcast distribution sites. Thanks for being a part of the Health Leader Forge community, and we'll talk with you again soon.